Chapter 6, Implementation and Evaluation. Implementation follows the assessment, data analysis, problem identification, and planning stages of the nursing process. Essentially, implementation is when we take action. During the implementation phase, the nursing interventions or nursing orders are carried out. Implementing care for a group of patients requires good work organization. Priority setting for tasks must always come first. Tasks for the shift must be determined and then prioritized. The handoff report will give clues about high priority tasks and imminent deadlines for certain tasks to be accomplished. Note the time of the last administered dose of pain medication. Any time-flexible tasks should be entered onto the worksheet schedule between any time-fixed task. Time-fixed tasks must be done at a set time. Critical thinking is essential to formulating a good work plan and time management strategy. When planning time for any uninterrupted care, always consider whether any visitors will be coming, when the diagnostic tests are scheduled throughout the day, what time the primary care provider might come see the patient, and medication administration schedules. If the patient's condition becomes more acute, your nursing care priorities will change. It takes practice to set priorities correctly for multiple patients. Before carrying out the specific interventions listed on the care plan, identify the reason for the intervention, the rationale for that intervention, the typical standard of care, expected outcome, and any potential dangers. Each intervention is either an independent nursing action or a dependent nursing action. An independent nursing action does not require a primary care provider's orders. However, it does still require critical thinking and clinical judgment. Clinical judgment is derived from experience and knowledge. The more experience that you gain working with patients, the more reliable your clinical judgment will be. In contrast, administering a medication is a dependent nursing action because this requires a primary care provider's order. Assisting the speech therapist by helping the patient practice speech exercises would be an example of an interdependent action. These come from collaborative care planning. The general rule is that any initial dressing placed at the end of surgery must be changed only by the surgeon unless you see a direct order to change it. If any drainage is extensive, the dressing must be reinforced with sterile materials. Always check facility policy regarding this. Another topic that often becomes questioned is whether or not a hot pack or cold pack can be applied without an order. Within Baycare, you need an order for both. Technically, no dressing should be changed, nor any hot or cold pack applied by the nurse unless there is a standard protocol or physician's order in place. Many hospitals and healthcare agencies use a collaborative care plan referred to as an interdisciplinary care plan, a clinical pathway, a care map, or a collaborative care plan. This multidisciplinary approach to patient care is an example of care coordination. The nursing care plan is not part of a patient's medical record. However, the nursing process and clinical judgment model are still used. Evaluation is judgment of the effectiveness of the intervention or plan, and this is a collaborative process. A case manager, usually an RN, will be in charge of reviewing the patient's progress along their path and see that any actions are carried out to determine whether or not that patient has achieved expected outcomes in a predicted period of time. When a nursing intervention on the care plan calls for a procedure to be performed, review the hospital procedure manual regarding steps involved. For efficient use of time, consider which interventions for a particular patient can be combined. This is called clustering of care. Critical thinking helps with organization. Every patient interaction should be used as an opportunity to collect further assessment data and collect a set of vital signs. Most of the routine care of the residents in a long-term care facility will be assigned to nursing assistants. The nurse will perform any invasive procedure and any sterile procedure. It is wise to always spot check the documentation of your nursing assistants because at the end of the day, you are ultimately responsible for adequate documentation on the care for the patient. Although nurses make periodic visits to the home, unless a private duty LPN is required, the family or patient will actually be the ones implementing the interventions that are listed on the care plan. At each home visit, review the plan with the family and review documentation to ensure that the care plan is being carried out properly. Each time a procedure is performed, a medication is administered, vital signs are measured, or something is done that is a planned part of nursing care, a notation must be made in the medical record. Nursing documentation must indicate that the nursing care plan has been carried out. If an intervention on the care plan is not documented, it is considered not to be done. Review the nursing care plan before beginning care to have a clear idea of all areas that will need documentation. Many hospitals will require that nurses document on every patient at least every 2 hours and make some note about a problem statement and nursing diagnosis every 24 hours. Care will be documented on patient flow sheets. After implementing care for the patient, document that care within their medical record. If a new problem is encountered, like beginning skin breakdown, a nurse's note is required to document these assessment findings. You must create a new problem statement/nursing diagnosis and a plan to correct or alleviate this new problem. The sooner the care is documented after it's given, the better. We always want to try to document in real time. The fifth and final step of the nursing process is evaluation. Once the interventions have been carried out, you must determine, have they been effective in helping your patient reach the expected outcomes? If your patient has reached the expected outcomes, then they have met the goals. If they did not, always try to consider why that happened. Why did they not meet the goal? Progress has been made towards expected outcome, but a plan may need to be changed by helping the patient in a different way. When an expected outcome is not met, it needs to be rewritten. Evaluation is a continuous process. The patient should also provide feedback when possible about how they feel about the expected outcome being met. Evaluation is based on data obtained from assessment, analysis of the data, and determination as to whether the specific expected outcomes are being met. The nurse considers whether the interventions on the plan are the best to meet the expected outcomes for those not met yet. If not, the plan must be revised. In the home healthcare setting, the nurse periodically assesses the results of interventions and analyses to see whether the expected outcomes are met. Again, if the expected outcomes are not being met, interventions must be revised. Ineffective interventions must always be revised. If expected outcomes are considered met, then the nurse's documentation must contain data to support that. Each nurse will determine whether or not there is a better and more efficient intervention to help the patient achieve their expected outcomes. Constant evaluation is an integral part of every aspect of nursing. Evaluation of nursing practice includes determining whether the nurse's actions were carried out with consideration for a patient's safety. Outcome-based quality improvement. This is improvement of quality of performance. There are numerous programs that are used to evaluate nursing care delivered to patients. A nursing audit is an examination of a series of patient records to determine whether nursing care for the patients met particular standards and particular outcomes. The outcome is typically expressed as a percentage of compliance. An audit is most often performed on medical records of patients who have been discharged. The purpose of evaluating nursing care is to achieve quality improvement by identifying specific areas that need changes. Quality improvement is considered a unit responsibility. Most instructors require students to come to the clinical experience with a nursing care plan or concept map in hand for their assigned patients. We don't do that. We make them at the clinical setting, but I do expect you to come with your patient report sheet, and I provide them all to you. Examples of which. The next two slides go over box 6.3 on page 81. It contains steps for construction of a nursing care plan. Nursing care plans are something that even RN schools are moving away from now. Really what we want to focus on and what we will focus on in clinicals is finding a priority problem for our patients and then formulating interventions as a plan and expected outcomes and goals for that patient. And we'll be practicing that with a SMART format, which means specific, measurable, attainable, relevant, and time-based. And that concludes this recorded lecture.